Welcome back. I'm now joined by Alicia Swink, who's a doctor over at St. Mary's Cancer Center. Thank you so much for stopping by.
Thank you for having me. I'm really excited to be here.
Absolutely. Well, first of all, welcome to the area. You're new over at St. Mary's.
I am. We just rolled into town over the summer and started at St. Mary's in the fall, and already, seeing a bunch of patients and really loving it. It's a great community, and I'm really honored to be a part of it.
Awesome. Well, we're so happy you're here.
Thank you.
Now, this month is Breast Cancer Awareness Month. So let's talk about what that means. You guys are highlighting it over at St. Mary's. How big of a problem is breast cancer here in the States?
Breast cancer is a huge problem. We know that 1 in 8 women in their lives will be diagnosed with breast cancer at some point. That means that either you or someone you know is going to be affected by breast cancer. Men are also affected. It's much less common, of course, but they are affected, and it's highly stigmatized for them. So that's a different problem.
Absolutely.
Breast cancer not only affects a lot of women in the United States, but it can really take a toll on their families and on their work lives. So we have a lot of work to do to take care of breast cancer, not only in this community, but in the nation.
Absolutely. I mean, my mom is a breast cancer survivor.
Really?
And I mean, what does that mean? First of all, how often should people be getting, women and men, be getting screened? And does that change if you have a family member?
Yeah, that's a great question. So the guidelines differ from group to group, but really every woman needs to have the conversation with her doctor about starting breast cancer screening with mammograms or mammography starting at the age of 40.
Okay.
Now, that may be different if you have an inherited predisposition for cancer. So if your mom had breast cancer and she was tested for one of these breast cancer genes like BRCA1 or BRCA2, and you know that's there, then your doctor may recommend that you start screening earlier than age 40. So it's definitely something to be aware of. For women who don't have a family member affected or who don't have an inherited predisposition, then again, have that conversation at age 40 and have a yearly or every 2-year mammogram to watch out for the cancer.
All right, good to know. Now, if one of those screenings does come back positive, let's talk about treatment options. What's available?
Great. So treatment options vary wildly according to how early we catch the cancer, and a lot of it's what we call phenotype, or just really its behavior and its character. So every cancer is different, just like every person is different, and in 2019, we have come to the place where we can really tailor every patient's treatment to them.
Yeah.
Usually that involves some form of surgery, some form of radiation in a lot of cases, and then where I specialize in chemotherapy and often in hormone therapy.
Wow.
So as you can tell, there's a lot of options, and like I said, it would be a one-on-one conversation and getting to know the patient and their tumor type, and then going from there to see what's best for them.
Okay, now what can men and women do to take preventative measures to maybe make sure that they don't get cancer?
Right, so prevention is best across the board in all tumor types and in all disease types. What we know about breast cancer is that women who maintain a good body weight and who also exercise regularly have a lower incidence of breast cancer. We also know that excess alcohol can increase the risk of a patient's breast cancer occurrence.
Interesting.
So women who exceed the 1 to 2 drinks daily certainly have an increased risk. The other thing we already mentioned was kind of that inherited predisposition.
Right.
So if that's something you know about, then again, screening early to help prevent the disease early on.
Awesome. Well, thank you so much for stopping by and talking about this.
Thank you.
Great information.
Thank you so much.
Absolutely.
Appreciate
We're going to
it.
have all this information available on westernslopennow.com. Tune in.